Hello, I'm Angie Bakke. I'm the Executive Director with Doctors for America. Thank you so much for taking time out of your weekend to be here to learn more about Medicaid expansion. I just want to provide some encouragement for you all in Florida, as I live in South Dakota, and we also worked to expand Medicaid by the initiated measure process, since we had a legislature that did not listen to the people and instead played politics. So I just want to offer you some encouragement and support. I worked on it 3 times in our state, and the third time was a charm. And I certainly am very hopeful that it will work that way for you as well. So let's get started as we talk about messaging and some of the challenges being, whenever you talk about something that can be political or controversial in any way, sometimes that can lead to debate and accusations, and that's certainly not going to be productive in any way, shape, or form to further the conversation. So it's really important that we meet people where they're at and understand what are their objections. And if you are familiar with the Gary Chapman's 5 Love Languages book, we really need to learn to speak the other side's love language so we really can understand what there are concerns. And, I've learned this lesson the hard way many times in my career regarding, our common approach. We want to convince someone to do X, which of course is what we want them to do, right? We defend it, we argue about it, we lecture, just it's all about, come on, this is why don't you get this? You should really understand this by now. And, that's just not the case. And so, and what you have in Florida too is the power of your tremendous coalition. So, talking about the impact, because it's the stories that will change people's minds and change their heart. And so, this is a little bit of an exercise, but oh my goodness, the first time I did this, this has both professional and personal use. So if you think about conversations with your significant other, your kids, friends, colleagues, whatever. So think about a time where you had a discussion. Maybe it's not Medicaid expansion. Maybe it's just a discussion about something that the other person didn't agree. So think about the intense part of that script and write it out. And, sometimes we have these, you'll notice we have these circular conversations that you say A, they say B, you say C, and it goes around in circles. As a result, the issue that you're talking about really never gets resolved because we're not really understanding where the other person is coming from. So part of this exercise is thinking about, how many questions did you ask? Tell me more about why you feel that way. And how many times did you state your case? This is where I found it to be really telling. And I learned, oh my goodness, Angie, you need to ask more questions and actively listen to the answers to really understand where that person is at. So when we talk about, and I love to put this word scramble up, and let me ask you the question: what word do you see there? I'll give you a second. I see silent, and I also see listen, because we need to be both to truly understand where another person is coming from. So, in doing that, let's talk about some different strategies that work. And we're going to go through all of these 3 different strategies. Our first one is knowing what networks you're activating. because when you go down a path, you start bringing other things up, right? Speaking to individuals' values. What do they care about? What's meaningful? And finally, telling coherent and memorable stories. And we're going to go through all three of these sections. So knowing what networks you're activating. So you say bacon, eggs, right? Peanut butter and jelly, macaroni and cheese. So that's really important. So people are going to think about things that when you bring up a particular topic. So if we are talking about Medicaid expansion and you are talking to perhaps someone on the other side of this issue, they might think of they don't work or they don't want to find work that has benefits, etc. So it's really important to think about when you go down a particular route, what is that going to bring up for them? And so we're going to go through this a little bit more. So when we talk about, what are some of the arguments? Okay, it's too costly for the state in the future. But on the other hand, we're talking about this is an opportunity for individuals to access high quality care, right? Again, on the other side, it's also affordable care, access at the right place. How many people that are in that coverage gap that make too much for Medicaid but not enough to qualify for insurance on the exchange, right? So oftentimes we see the uninsured getting their care in the most inexpensive place and the least efficient for them. And that would be in our emergency departments, right? And so it costs more. Someone that's coming in with issues with their diabetes, is that the place to get education on maybe how to eat better or smoking cessation and how to stop smoking? It another argument, it discourages able-bodied people from working. But we know that 79% of individuals who are on Medicaid, or excuse me, 76% of adults eligible for Medicaid are working. So, that having some of those facts and figures for your state is really important. If we expanded Medicaid in Florida, it's going to force the state to raise taxes. And that's not necessarily the truth, but it goes back to everyone should have health care and access to comprehensive care. And sometimes you might even get the argument that Medicaid expansion is socialized medicine. It is access to care. And that's really, again, the focus when we think about, you know, when you bring up Medicaid expansion and the importance of expanding that in Florida, what is that going to bring up? So knowing some of these arguments and that may come up that are in the red, but yet on the green side, you can talk about everyone should have access to healthcare. That's something that's pretty undeniable. So the second part of our strategy here is to talk about strategic messaging and speak to individuals' values and emotions. So, of course, the number one piece of having that successful conversation with someone that is not sharing your opinion of things is making sure that they feel safe, that this is an environment that regardless of at the end of the day we can agree to disagree, and it's not like watching a television news program where people are upset and getting ready to leave, etc. So that you want to have that space where people are comfortable to share their opinions and also to ask questions. Because those of you that are here today, you are an expert in this field. I mean, you may not know about everything that's covered in Medicaid and everything about the program, but you know what it means for individuals to have access to healthcare. And that's what you can share, and sharing those values. So you want to share the values that create emotions, not destroy emotions. So word choice is really, really important. So when we talk about uh, Medicare or Medicaid, we talk about people who rely on Medicaid for their health insurance. The unemployed, we don't say that, saying that people who've lost their jobs. A lot of people can relate to losing their job, right? At one time or another in their life. So you don't want to be defined by that word unemployed, uninsured. So people who can't afford healthcare for their families. And that is that group of people that we're talking about here. So, you know, using this compassion related language, Obamacare, things like that, fixing our healthcare system, making sure that everyone can get quality care. Because when you talk about, again, values of everyone having access to healthcare, that's something that we can all get behind, whether regardless of party or beliefs or whatnot. And this is a really important note here. If you don't feel it, don't use it. Um, there are two ways, of course, to lead. As if you think about as a manager, you can lead by power and authority, and that's just simply by title. But you all have the opportunity as clinicians and health advocates, because you are here, you care about people and their access to healthcare. So you are having these conversations using the power of influence and your perspective. And again, that involves meeting people where they're at and discussing, you know, what are their concerns? Going back to that script that we talked about a little bit in the beginning. So asking questions, finding out, well, tell me more why you think that. Have you had experiences that made you feel a certain way? Questions give you information, and information helps you better ask better questions to have a more successful conversation. So again, it's about adopting that mindset of curiousness. And this isn't about judging. We have all had our feelings, our beliefs, our thoughts have been developed through experiences and our environment. So it's really understanding where people are coming from, and also knowing that there are some individuals that we're not going to change their minds, but you can have a respectful conversation and say, okay, I can understand where you're coming from, and thank you for listening. Well, I want to share a really important story with you now. This is Laura, and she's from Okeechobee, Florida. And I apologize if I said that wrong, but when Leah was growing up, her parents were self-employed and the family didn't have health insurance. And it really proved to be very consequential for her family when her mother died from a cancer diagnosis that really could have been prevented um, if it was detected early. So because she did not have insurance, there was no way. And this experience really inspired Leah to ensure that members of her community, most of whom are on Medicaid, receive the support that they need. And right now, Leah is a leader at a local nonprofit that helps people with food assistance, mental health therapy, educational and career development, drug treatment, and other crucial supports. And the nonprofit that she's at has provided community members with food and other essentials throughout the COVID pandemic and beyond. And Leah knows that these basic health services that it provides are really critical for her friends and neighbors. And she says, here in our community, this is life and death. When you're in a rural area and parents are getting by day to day, if they don't have coverage, they don't seek health care until it's too late. So having Medicaid can make a huge difference. So this is just one story from Florida. Think about the stories of people you know, your patients, your friends, your neighbors. And we know these stories are important. Facts, figures, all the analysts that policy wonks have. I mean, those numbers are important too. But are you going to remember them? Or are you going to remember that story I just shared about Leah? And the fact, I love these little quotes about why stories matter. And uh, part of it is just the fact that we recall stories and instances because we remember the people that they're associated to, not necessarily just the facts. So today, think about your stories. Ask, maybe you even want to write them down and perhaps even ask a patient or colleague, friend that isn't covered, that would be covered if Medicaid was expanded in Florida, if they would be willing to share their story. Because you and a person who is impacted by not having access to health insurance, that's like double powerful, right? So now I want to talk about the next piece of our conversation and how to get involved. So at Doctors for America, we teach doctors and medical trainees how to do advocacy because unfortunately those aren't skills that they get during their medical training, typically in medical school and or residency for that matter. So we provide skill building sessions, and then you also have the opportunity to practice the skills that you are learning at DFA and use them to advocate on other things. These are the three areas that we work on at Doctors for America, but I want to be really clear to say that, whatever is important to you, that's great. At DFA, we just want to help you be the best advocate that you can be for the things that you care about. If the things that you care about fit in these areas and we're working on it, this is just another way for you to have practice at those. So, for example, we call these three circles impact areas. And we work in issues like access to affordable care. There, we're working on things like Medicaid expansion, prescription drug affordability boards, pharmacy benefit manager issues. We work to help the Inflation Reduction Act get passed. So Medicare would have the ability to negotiate drug prices on 10 of the most prescribed drugs by Medicare, which we know that, before this, the federal government was paying sticker price for every drug and the amount of money that doing this saves. So now we're dealing, of course, with the aftermath and all of the lawsuits levied by pharmaceutical companies against the government for doing this. But those are some of the things that we work on in access to affordable care. And we also have an FDA task force, which works to strengthen the FDA in both clinical trial diversity and making improvements on the accelerated approval process. And we are the only non-pharma voice in this space working on that. So that's access to affordable care. Our second area that we work on is impact area is called community health and prevention. There you'll see us work on topics such as gun violence prevention, teaching clinicians how to talk to their patients about safe storage. We talk about ERPO and emergency risk protection orders, and we advocate for things that strengthen gun laws, closing the gun show loophole, etc. A second subcommittee in that particular area is substance use disorders. So, of course, addressing the opioid crisis and fentanyl issues that are slamming the country, making sure that clinicians have access to training so they can provide patients with life-saving access to drugs, similar to methadone. We do a lot of advocacy in this space, again, about making sure that there are mental health supports and there is advanced treatment and access to patients and clinicians who are suffering from substance use disorder. And then the third subcommittee is public health. So, of course, that really came out of COVID. And so following up on that and any sort of other, communicable diseases. And a lot of the work right now has to deal with building vaccine confidence, right? Because of all of the misinformation and the numbers of vaccinated individuals having decreased so greatly since the pandemic. And then our final impact area is health, justice, and equity. That's where we work on access to reproductive care, gender affirming care, and comprehensive sex ed, and also decriminalization and liberation. And I want to mention that all of the work that we do, we work to address medical racism and make sure that we are uh, addressing the communities that need our advocacy the most, communities of color and in those individuals that don't have a voice. So your role is so important, as you can see, whether it's speaking on Medicaid expansion or perhaps it's climate change in your state that you wish to work on. So this last slide this was the FDA task force, and we were in Washington, D.C. doing Hill visits. We do quarterly Hill visits. And so the power of the white coat is real. You are experts. If you are a health advocate, your lived experience working with patients or individuals that have those powerful stories because they have access or they don't need to be shared with your local community leaders, your legislators, and of course, if you are able, the media. So use that power of the white coat, and I think you'll find that you'll make a difference. If we can help you at Doctors for America learn the skills to help you feel more comfortable, join the work. Again, we want to help you be the best advocate that you can be. But today you are here because of Medicaid expansion in Florida. So to get people to sign those forms, to get it on the ballot, and after you get that done, helping to get it passed, talking about the impact that having coverage or not having access to health coverage has on your friends and neighbors in the state of Florida. And we at DFA will be right here next to you, walking beside you, helping you on this path. And please do reach out if we can assist you in any way. Thanks for being here.